Since the first case of Covid-19 was reported in Kenya back then in March of the year 2020, there have been measures from the Ministry of Health to ensure that the country is curbing the spread of this virus.
As for quarantining, mandatory quarantine is not forced quarantine, it's mandatory quarantine.
With the emergence of the Covid-19 vaccine, AOSK, in partnership with Hilton Foundation, started a 6-month campaign to ensure that there is creation of awareness about the Covid-19 jab. In this campaign, the AOSK is targeting 80 sisters-led run health facilities. The aim is to ensure that the Catholic sisters are embracing the Covid-19 jab and also educating the communities around them on the importance of being vaccinated. After the sisters have been trained about a number of issues about Covid-19 by the AOSK, a random visit was made to one of the healthcare facilities to see how they're embracing the Covid-19 vaccine.
Today we have come to check on what the sisters and the healthcare workers are doing here, following the trainings that we have been doing, and we are happy that they are doing quite good work. In this hospital, we have come to understand how they are doing the awareness creation among the populations they serve in the community and among their staff.
Since that our main target is the Catholic sisters, we were lucky enough that the day we visited Kalimoni is the day one of the sisters at Kalimoni Healthcare Facility was receiving a second jab of the Covid-19 vaccine. Sister Emilia starts by talking about the experience she had after receiving her first jab.
I had my first vaccine and I'm due for the second one, which I'm going for it today. I'm a member of AOSK, that is Association of Sisterhood in Kenya. I will encourage those who are outside there who are so afraid of taking this vaccine because of what they have seen in the media, people talking against it. I'll say I have experienced it and it is good. Though there may be some effects on other people, but not in everybody. Because I know when I took those we took together, most of them didn't have any side effects. Even though I was one of those who had some side effect, it was just a fever for some days and I was up again. I'll tell you that even if you have the side effect and it may be painful, but it is for a short time. The benefit is more than that side effect, because we want people to stay alive, and so we encourage everybody to take.
Now that she was due for the second jab, we followed up to see how the procedure of vaccination is conducted at the Kalimoni Hospital.
We're given you, so you're only allowed to take, you can take paracetamol. Those side effects are not going to last so long, but if it worsens, you're welcome to come back to the hospital and report any side effects that you have.
So,
Give you.
how do I keep my hand? I forgot to keep like this.
The left one will be better.
Yes,
The left one will be better. So I'll give you 0.5 on the left there to the muscle.
not okay.
It's a bit. So there's going to be some pain.
No.
No pain. Okay. Fine.
After a second jab, as it is a norm in all the healthcare facilities in Kenya, Sister Emilia was provided with a certificate to certify that she was fully vaccinated against COVID-19. At the Kalimoni Hospital, we wanted to know how much people have been vaccinated so far in that healthcare facility.
I would want to encourage people to come for vaccination because the infodemics that people have outside is not what is the reality. As of today, we have managed to vaccinate 782 clients. Out of this, our staff, 90% of our staffs have been vaccinated. Those who are yet to complete the second dose will begin receiving theirs on Friday, as it has been open for 8 weeks.
Has the AOSK trainings added any value to Kalimoni Hospital?
Recently, we went for training on multiple vaccines. The impact has been felt in the hospital. That is when almost all the staff now woke up and decided they are going to get their vaccines. The other one was sensitization on vaccines. That was done by the person in charge of IPC through CME, which was done a week ago.
Beatrice Mothoni, a lab technologist at Kalimoni Hospital, talks about the preventive measures of the COVID-19 virus.
The preventive measures that we encourage currently, one of them is hand hygiene. And when we talk about hand hygiene, it's simply hand washing. And it's one of the most important infection prevention control for all of us as healthcare workers and also the people in the community. And it helps prevent infection from one person to another. The other one is social distance. We are supposed to keep a social distance of 1.5 meters from one person to another to prevent infection. Then we are also encouraged to take the vaccines that are available in our nation. We have AstraZeneca, we have Moderna, Johnson, and all of them are equally potent, and they are going to protect us if we are vaccinated. The other one is about disinfection or sterilization of equipment in a healthcare facility. And disinfection is, we use 0.5 sodium hypochlorite, and it helps kill the viruses in our working areas. And also we sterilize the equipment we use in theater, dental, to prevent cross-infections.
Mr. David Bula, a healthcare worker at Kalimoni Hospital, encourages people to get vaccinated.
I work at Kalimoni Mission Hospital. Personally, I've been vaccinated against COVID-19. Vaccines save lives. Vaccines help us so that when we get this COVID, not that we will not get it, so that when COVID-19 disease comes in, we will not be as sick as a person who has not been vaccinated. COVID-19 disease, speaking from a professional point of view, is a very expensive disease should you be admitted. So the most common symptoms we find are cough, there is the fever, then there is the loss of taste and smell, and then we have the moderate symptoms, that is where we have joint pains. We have some people present mostly, in fact, currently we have people presenting with diarrhea. And the most severe symptoms we find the difficult breathing, then some of them are motionless, cannot move, and then there is severe chest pain.
Mimi ni mfanyikazi hapa Kalimoni Mission Hospital kama askari, na nimefurahia kupata chanjo yangu ya Covid-19, na ningehimiza wenzangu na marafiki na jamii wakuje wapate chanjo kwa sababu ni bora kujikinga.
I am so happy to say that following the trainings, Kalimoni Mission Hospital has done good work. So far, they have over 700 vaccinated, both the first and second doses, and their staff, over 90%, have received their vaccine. Some of them were even taking it today, and we really appreciate that. We applaud the management of Kalimoni Mission Hospital, the sisters, and the staff who have taken it upon themselves to be good examples, to encourage people by doing it. Walking the walk is the way if we are to kick the virus out of our country. I encourage everyone to do the same.